Now I'm delighted to be joined by APA President-elect Dr. Vivian Pender. Dr. Pender, thanks so much for joining us today.
Thanks so much for having me here and giving me the opportunity to speak at the annual meeting.
Absolutely. This last year has certainly been a very turbulent one with the global COVID pandemic, a bitter U.S. presidential election, as well as movements like Black Lives Matter highlighting systemic racism. As the incoming president of APA, what are your priorities moving forward?
You're absolutely right. We are living in unexpected, epic times. This year presented an opportunity to build upon what the APA did in 2020, focusing on the pandemic and its own structural racism. However, along with these issues that you mentioned, the past year also exposed the widespread prevalence of mental health inequities, such as the discrepancies in accessing mental health care and increased mortality in minority communities. So to advocate for social justice, I am asking the APA to spend the next year focusing on the socio-political determinants of mental health. That will be a task force that is going to be established.
And you also serve as the APA Special Advisor to the United Nations. What is your perspective in that role on the global challenges that are facing mental health?
Most of the global challenges facing mental health care are generally the same as in the U.S. Mental disorders are generally stigmatized. There's lack of access to mental health care, and there's undertreatment and underdiagnosis. It's a complex set of issues, but I think one answer lies in a recent UN initiative, and that is mandating universal health care for all countries. It's called #UHC, where they are hoping that their motto is let no one be left out. That is, everyone deserves the right and dignity to have health care, especially mental health care. As you may know, the APA became a non-governmental organization of the UN in 2014, and that gives us special consultative status with access to the entire UN system, and we're able to partner with them, with their agencies and mission states and other NGOs.
It seems like a lot on your plate. How can the APA help to meet those challenges?
Well, I believe that the APA is an organization that can make a change. The APA has a mission to promote that people with mental illness and substance use disorders are able to access effective and humane psychiatric treatment. So we can use our powerful voice to educate and advocate for policy initiatives that affect people not only in the US but globally. The APA is a very respected institution worldwide, and we can speak out and advocate for people who have mental illness and mental health disorders.
Wonderful. Final question for you today. How can members get involved in APA and help support this work?
The APA offers members many avenues for involvement. There's the well-established route of participating in district branch activities. Usually there's a district branch committee that would suit a member's interest and easy to join. Also, APA caucuses are open. They're self-forming on a particular topic. They're open to all members. Anyone can join. So recently there actually has been interest in establishing a caucus on social determinants of mental health that will be open to all members who have an interest in that topic. I think those are the best ways to get involved.
Wonderful. Plenty of ways to get involved. Dr. Vivian Pender, President-elect of the APA, thank you so much for your time today.
Thank you very much for having me.